Hey everyone, and welcome. Today, we're going to dive into a nursing skill that is so much more than just making a patient comfortable. We're talking about client positioning, which is, believe it or not, a critical and often life-saving intervention. We're going to get into the why behind the how, because that's what really makes a difference. So let's get right into it.
So let's just ask the big question right off the bat. Why is this such a huge deal? I mean, really, why is it a life-saving skill? Well, it's because the way you position your client can literally prevent a catastrophic complication, it can promote healing, and it can even make a medical procedure possible. This isn't just fluffing pillows, it's an active intervention, just as important as giving a medication.
And this quote, it really just hits the nail on the head. See, positioning isn't about mindlessly following a list. It's all about your clinical judgment. You're basically playing chess. You have to think ahead. You're anticipating the risks, like bleeding or swelling or trouble breathing, and you're using position as a powerful tool to keep your patient safe.
All right, enough talk. Let's put this whole idea into practice with our very first NCLEX-style quiz question. Time to see what you got.
Okay, so picture this. Your patient just got back from a liver biopsy. Now, you know the liver is an incredibly vascular organ. It's just full of blood vessels. That means your number one priority, the absolute most important thing you need to do, is prevent a hemorrhage. So what's the right position to make that happen?
Here are your choices. Is it A, supine, just flat on their back? B, left lateral, lying on their left side? C, prone, so face down? Or D, right lateral, lying on their right side? Go ahead and think about it for a second. All right, locked in your answer? The correct answer is D, right lateral.
And here it is. This is exactly what it should look like. The patient is lying on their right side. A lot of times you'll even tuck a small pillow or a rolled-up towel right under them at the puncture site. Now, let's get into the really cool part, the powerful why behind this simple-looking action.
So here's the brilliant part. We're actually using the patient's own body weight as a medical tool. How cool is that? By having them lie on their right side, all of that weight creates direct pressure right on the biopsy site on the liver. It's basically like creating an internal pressure dressing. That pressure helps to stop any bleeding and allows a clot to form. It's so simple, but it is so effective.
Awesome job on that one. Let's keep the momentum going with our second scenario. This one is all about post-op care after a mastectomy.
Okay, new situation. This time your client has had a mastectomy, and really importantly, they also had some axillary lymph nodes removed. So the big bad complication we're worried about here is lymphedema, that really painful chronic swelling. Our goal is to prevent that fluid from building up in the first place. So what's the best position to do that?
Let's look at the options. A, supine with the arm flat by their side. B, semi-Fowlers with the affected arm propped up on a pillow. C, high Fowlers with the arm just hanging down. Or D, prone. Okay, you know the drill. Take a second, make your choice. The correct answer here is B, semi-Fowlers with the affected arm elevated on a pillow.
Okay, so let's break this down into its two parts. First, the bed itself. We want them in a semi-Fowler's position. That just means the head of the bed is up at least 30 degrees. Now, that helps with breathing and comfort for sure, but it's the second part of this position that is the real game changer for preventing lymphedema.
And this is exactly why it works. When those lymph nodes in the armpit are gone, the body's natural plumbing system for lymphatic fluid is disrupted. It needs help. So by elevating the entire arm on pillows, making sure the hand is higher than the elbow and the elbow is higher than the shoulder, we're just using gravity. It's basic physics. We're giving that fluid an easy, downhill path to drain away from the arm, preventing that painful pooling.
So let's zoom out for a second and tie this all together. We just looked at two completely different clinical problems, right? And they each had a completely different positional solution. So what's the big takeaway here? What's the core principle that connects them both? This comparison just makes it crystal clear. For the liver biopsy, our goal was to stop a bleed, so our action was to apply pressure using body weight. For the mastectomy, our goal was to prevent swelling, so our action was to promote drainage using gravity. In both of these cases, positioning was not a passive, nice-to-do thing. It was an active, targeted therapeutic intervention, just like a medicine, chosen specifically for the physiological risk at hand.
And that brings us to one final thought I want you to take with you into your own practice. Think about all the other things you do every single day. You know, things like encouraging a patient to cough and deep breathe, or just making sure the call bell is within reach. What's another one of those simple-seeming actions that has an absolutely critical why behind it? Because thinking that way, always asking why, that is the absolute heart of great nursing. Keep asking those questions, and thanks so much for joining me.